Good morning, good afternoon, depending on what part of the country you're at currently. This is Andy Dwyer with Colorectal Cancer and the University of Colorado. We're going to begin our webinar in just a few minutes. I just want to welcome you all today. The speaker, Dr. Lisa Corbin from University of Colorado, is joining us, and we'll provide a little more information about Lisa shortly. Just want to remind all of you that today we are going to be asking questions and answer session at the close. The session will be moderated by Kevin McAbee, who's actually joined the Fight CRC team in the last month. So welcome to Kevin. Special thanks for Danielle and Michael on the Fight CRC team as well for joining in today and providing our technical support and guidance. So with that, I hope that you're all having a great day. I know that the weather in some parts of the country have gotten rather chilly. So we'll just give another 1 minute and then we'll get started with the presentation. We have the numbers climbing, so just 1 moment. Okay, Kevin, next slide. Okay, great. So just a quick reminder that our archived webinars are at the Fight Colorectal Cancer site that's listed. Dr. Lisa Corbin will be our presenter today, but we also have a number of topics that have been broached through the webinar series, the family history, as well as this last month, and all of the guidance and information around how to collect family history is available at our site. And we encourage you, as we all hop into the holidays, to definitely make the most of gleaning information about the incidence of colorectal cancer within families, but also collection about adenomatous polyps as well as other types of health conditions in cancer. After the webinar today, we will be asking some questions around your interest in this topic as well as satisfaction with the material that we presented. And then we're also going to be, again, be able to ask real-time questions to Dr. Corbin, but the way that we'll do that is have you key those in and type those in that will be shared with our team, and Kevin will moderate that session at the close. We will be, like many of our events and functions, we will actually be twittering, or tweeting actually I should say, with our the hashtag #FightCRC or CRC webinar. We're actually here today at University of Kansas with the RATS training, and so Danielle and Shauna and myself with Nancy Roach are very excited to continue the efforts around the advocacy efforts here. So very excited to be joining you from yet another location with KU Medical Center and team. Next slide. Just as a quick reminder and mention, our Stage 3-4 Guide in the Fight, a resource guide for colorectal cancer patients, is continued to be offered at our online store at Fight CRC for free downloads of PDFs. We're very excited about this resource. We've had nearly 400 people who've downloaded since July. We're in development as Stage 2 guide. Kevin McAbee and myself will be in touch probably with many of you to ask about if you've received the guide, specific input, and for people who are Stage 2 survivors or caretakers or medical providers, providing some input about what you'd like to see in the next iteration of our guide. This is actually something that we're very excited about, very pleased to offer, so please take some time to go ahead and check that out on our website. Next slide. And as a quick reminder, Fight Colorectal Cancer is very much dedicated to the fight around research initiatives. Since 2006, 100% of our funds are donated to late-stage research around different, specifically bench science and direct research science, medical science, through our LISA fund. I think many of you might have seen and heard over the last week the JAMA, the surgery article that mentions concrete data that does show increased incidence amongst people who are younger than 50 years old. I think I'm talking about the less than 50 degrees because it's so chilly today. Those who are younger than 50 who are at increased risk of colorectal cancer and we're seeing the increase in very young people being diagnosed with cancer. And so the LISA Fund and other initiatives definitely help speak to this and really look at causation and a lot of dedicated resources. So we just want to remind that this is a fund that can be donated to, and then very much that Fight Colorectal Cancer is very much committed to the research and advocacy around this specific topic. Next slide. Just a quick reminder that, of course, we provide definitely information and try to provide as much timely and pertinent information around disease and topics. However, this is no substitute for direct medical care, and in any situation there's an emergent need to please continue to use 911 as specifically the resource for direct medical care, and then of course making sure to provide care with medical providers in terms of recommendations. We are excited to have Dr. Lisa Corbin, next slide, who will join us today, who is actually a teammate of mine at the University of Colorado, who's an associate professor at our internal medicine team at the university. Lisa and I have specifically worked together on a lot of community as well as direct clinical interventions for cancer survivors, thinking about how integration of medical care and comprehensive medical care is provided to folks specifically after a cancer treatment. And I have to tell you, I think of the team that I've worked with, I think that Dr. Corbin is probably one of the best educators, one of the best advocates for patients, and someone that I really enjoyed working with. And so here at our University of Colorado Comprehensive Cancer Center at CU, Dr. Corbin definitely leads a lot of the complementary and alternative medicine therapy and recommendations in terms of thinking about quality of care for cancer survivors. And so with that, I'm very excited to introduce Dr. Lisa Corbin and have her share a little bit further, of course, about complementary medicines. So Dr. Corbin? And we'll just give 1 minute real quick while we get the slides in order for Dr. Corbin to jump in.
Good morning. Can you hear me? Hello?
Yes, you definitely
do. Okay, everybody
else
is muted. Oh, sorry about that. Let's see if this will work. Are you able to see my screen?
We sure are, Lisa. Yes, we are able to. Okay. So I think if you're able to do from current slide and
Yes. Sorry, let me do that.
Should be.
It's hiding.
I think slideshow.
Thank you. I'm used to having it in the bottom, but this little thing is in the way here, so I can't see it. I'm sorry, everybody. Please stand by.
If you do, I think if you do slideshow, Lisa, on the slideshow, I think sometimes that will help. Next to review.
I see. I'm sorry. Thank you.
Okay,
I'll skip through these guys.
Very good.
Okay, now that's working. Yes.
Perfect. Yes, we can see it.
Okay. Sorry, everybody. Sorry for that. It's a pleasure to be here. I was driving in this morning. I'm speaking from Aurora, Colorado, and driving in this morning, my car told me it was 1 degree outside, and I thought 1 is the loneliest number, and now sitting in my cold, dark office all by myself speaking is lonely as well. So I'm glad to be here. I wish I weren't alone, but I know that you guys are out listening, and so I'm really looking forward to an interactive question-answer session at the end. So thanks, Andy, for the introduction. Thanks, Danielle, Michael, and Kevi for the help, and in advance to Kevi for moderating the session at the end. Now, once I figure out how to advance the slide, that will be helpful. Any hints from the home team? Oh, okay. Here we go. So
if you press the arrow button over.
Yeah, the arrow didn't work, but the mouse button does. So I think we're good. So I first, when I talk about complementary and alternative and integrative medicine, I like to start with definitions because I think that people sometimes think that they're going to a talk where the speaker looks something like this, and you guys can't see me. That was an old picture they showed. This is really what I look like. But first of all, the first term on the block out there to describe therapies not historically part of conventional medicine was alternative medicine. And that was talking about things that you wouldn't typically find in a U.S. hospital, such as chiropractic, acupuncture, and massage. But then people did more research and they realized that the term alternative was a little bit misleading because most people who are interested in these therapies aren't using them as true alternatives to conventional medical care, but they're using them along with conventional medical care, and so that's when the term complementary medicine came about. And I do like to point out that complementary is spelled here with an E, not an I. You spell it with an I, it's, it means you look nice today, or which, in that case, I hope we're all practicing complementary medicine, or it means that it's free, and I think that's one issue with some of these therapies is they can be far from free. So we're talking about things, chiropractic, acupuncture, massage, herbals, those things fall into that category. There's also a somewhat new term on the block called lifestyle medicine, and lifestyle medicine is the use of things that you can do for yourself, basically, to achieve health benefits like stress reduction, exercise, nutrition, things that you might need a little bit of guidance on, but definitely play a big role in health. And then the latest term is integrative medicine, and this is where the CAM therapies and the lifestyle approaches are actually coordinated with the conventional medical treatments. So I think there's plenty of people out there that are seeking the complementary alternative medicine treatments themselves, like perhaps going to get some yoga, and then they're also seeing their oncologist, but the oncologist and the yoga provider are not chatting with each other. And I'm a little biased here running the Center for Integrative Medicine, but I think the best way to use these therapies is when everybody is communicating, and that's the communication is the key to the term integrative medicine. So who uses these therapies? And I tend to throw all those terms around just when I'm speaking about the therapies themselves. I may say complementary medicine, I may say CAM, I may say alternative medicine, but I'm not really talking about the way they're practiced as much as just the therapies themselves. So surveys have shown us that nearly 50% of the general public is using services such as acupuncture, massage, or chiropractic, and it's certainly higher in patients with a CAM diagnosis. And looking at what kind of CAM services they were using, 80% were using spiritual practices, 60% using some sort of supplements, and 60% using movement or physical therapies like yoga, for example, or massage. And they gave, in this one survey, a lot of reasons for use. One was just to feel hopeful, which I think ties along also with this third bullet point, that people like to have some control. So when you go into the oncologist and have your diagnosis, often at that time there's not a whole lot of control because the oncologist is directing your care. And I think using CAM treatments is one way to take some of that control, and I think that's important to keep in mind. People also were looking specifically for health benefits that would boost their immune system. They were interested in trying to prevent recurrence of their cancer, and also hopeful that the use of CAM therapies would be an augment to their conventional therapy and make that work better and actually help treat the cancer itself. So I just have a few case vignettes just to get us all thinking about what we're talking about and how this might look in real cases. So I have 3 real patients to share with you. One is MS. She's a 54-year-old woman with metastatic colon cancer, and she was able to keep it in check with chemotherapy, but she was getting so sick every time she had the chemotherapy that she had to quit her job. And she came to the Center for Integrative Medicine and said this is her last resort. Somebody had mentioned that we might be able to help her tolerate the chemo better, but she was coming in to see us, and then she was going to take a last hurrah trip to Greece. And she decided after discussion with us that she would try acupuncture before her chemotherapy, and this for her turned out to be the key. And she was able to continue getting her chemotherapy and even was able to go back to work for 4 years. We have another woman who was a 60-year-old female runner. She had colon cancer. She was treated with chemotherapy, radiation, and surgery. And she was saddened to find that after treatment, she was still fatigued and could only run 3 miles, whereas prior she would go out for 10 miles a few times a week. And so we talked about exercise and local programs for cancer exercise rehabilitation in particular. She worked with a dietitian to improve her diet. She worked with a psychologist on mind-body strategies for fatigue management, And after 18 months, she was back to her pre-treatment self. Then one final case to present is SS, a 62-year-old male with rectal cancer who was just starting treatment for chemotherapy, treatment with chemotherapy for his rectal cancer. And his family insisted that he needed to take herbs and supplements and change his diet radically. Some of his family told him that his chemotherapy was toxic and, quote, would kill him, not the cancer. So he was understandably anxious about the treatment and made anxious by these family recommendations and felt caught in the middle. He also had some pain at the site of a surgical procedure that wasn't going away. So what we offered for him was to work with one of our psychologists for anxiety reduction and also to give him some tips and tools for how he could respond to this very well-meaning family. He began massage therapy for anxiety and for his pain. He discussed supplements and diet with a dietitian, and he used acupuncture during his chemotherapy, and he came through the treatment better than he had expected. So I think all three of these situations are illustrative of the types of folks that we see with cancer in the Center for Integrative Medicine and how an integrative approach might be helpful in different situations. So when I sit down and talk with patients, and I would encourage you guys to keep this outline in your head, when you're interested in using an integrative approach, the most important thing is to avoid things that might cause harm. And then also don't jump over the lifestyle and self-care, because these things can be incredibly helpful, and I think we as physicians tend to overlook them, but patients tend to overlook the value as well. So working on consistent regular sleep, the right amount of exercise, not too much perhaps, but not too little, mind-body techniques, and nutrition. And then certainly consider CAM therapies that are safe and plausible, and I'll spend a little bit of time talking specifically about herbs and supplements, acupuncture, and massage. So first I want to start out by telling you things that I think that you should avoid if offered to you, and some reasons why. So the first one that's on my hit list here is illustrated by this cover of the Weekly World News from many years ago. It says over here, Di cures all her ills with weird water therapy, and this is Princess Di. And it says she has her bowels washed out with 12 gallons of water 3 times a week. Now she's tired. She's free from tiredness, anorexia, headaches, allergies, depression, and candida. So what Princess Di was doing was called colonic hydrotherapy. And just as it was described here on this cover, colonic hydrotherapy is taking a large amount of something like water and washing out your bowel. And proponents of this therapy say that it's necessary to cleanse your colon of toxins, and that will help pretty much any medical condition, as you can see by the list there that Princess Di claimed to benefit from. So they purport that the colon is just filled with toxins, and without any external help, toxins will be wreaking havoc. And I've seen some late-night TV infomercials where they say, John Wayne died with 10 pounds of undigested fecal material in his colon, and they try to imply that that's the reason that he died. But as anybody with colorectal cancer knows, that it's pretty easy to clean your colon with just an enema and a little bit of help from above. And when you have a colonoscopy, the colon is not gunked up like some sewer pipe. It's pretty, it's pink, it's shining, it's glistening. You don't need a lot of extra help to cleanse your colon. And the bacteria that are in your colon, a lot of people have heard of the concept of probiotics. So we have about 800 million different species of bacteria, and just billions and billions of bacteria in there that are providing a lot of help for us. And so washing them out unnecessarily with really aggressive hydrotherapy regimens like the 12 gallons of water idea wouldn't seem to be a good idea. Nobody has ever studied colon hydrotherapy and found that it is helpful for any listed condition, and so there's no benefit to balance the risk against. And why it's on my harmful list is with the risk. So anytime you put a hypotonic solution like water into a space that has a permeable membrane like the colon, the water is going to naturally cross that colon lining and go into the bloodstream and dilute your blood. And so there have been case reports of people with super low sodium levels and having seizures and comatose and spending weeks in the intensive care unit after doing colon hydrotherapy. And I did have the misfortune of seeing a woman who was trying to treat breast cancer with colon hydrotherapy a number of years ago who came into our emergency department with a super low sodium level, seizing and in a coma, and that was no fun. It certainly could have been prevented. The other risk is colon perforation. Anytime you especially if somebody has got an anastomosis, this is the last thing you want to be doing is putting large volumes of fluid in there. You risk perforation. And then infection is also a concern. We had on the western side of Colorado about 10 or 15 years ago a fellow who was providing this therapy to patients but wasn't cleaning his equipment properly between patients and wound up with an outbreak of amoeba that killed a couple of people and put a few other people in the intensive care unit. So I hope I have made the case for you to avoid colon hydrotherapy in the way that it was described here by Princess Di. I want to stress that absolutely you need to get your colon cleaned before you have a colonoscopy, or the doc isn't going to be able to see anything, but that is a totally different story, and that's not large volume, and that is therapeutic. But doing the repeated large volumes of water or coffee or soap to try to, quote, cleanse the colon is unnecessary at best and harmful at worst. Chelation therapy is another therapy that I think is harmful. So again, this is an idea that it's a detoxifying kind of therapy. Kind of started in the heart disease world with the idea that if you could remove calcium from the bloodstream, then it would naturally leach out of coronary arteries where it might be deposited, and it would leach out of the coronary arteries and reduce the burden of plaque and heart disease that way. And so what would be done is somebody would be given a chelating agent, IV, and if there's scientists out there, you'll recognize the term EDTA. So that binds the calcium and makes it into a form that the kidneys can excrete. Otherwise, the kidneys can't get rid of it. Nobody's ever shown that that's helpful. There have been a number of studies that show that it actually does not work. But once it sort of took off, then people started promoting this as a treatment for pretty much anything. And so if you go to a provider who is very alternative, they may suggest to you chelation therapy as a method to get rid of toxins, and they may promote this as a therapy for cancer, but there's been no evidence that it works outside of a routine conventional medical setting. In which cases, certainly if somebody is clearly toxic with lead or mercury, then they need chelation to get rid of those specific heavy metals. But just for the average person trying to, quote, detoxify, it's not a good strategy. And some major concerns with this therapy are just getting the repeated IV treatments, getting a chemical in your body that you don't need, and getting rid of heavy metals that you do need. For example, calcium is an important heavy metal, and you do need to have that around. And so I worry about people dropping their calcium levels or other important metals that are needed for your enzymes to work. Ionic foot baths, I've got a couple of slides on those, and I'll show you a little bit more in just a second. Super restrictive diet, so this is one that I think is especially important for the oncology population, because when you have a diagnosis of cancer, lots of folks will tell you that diet is the key to treatment. And I agree that diet is very important, and there are a lot of things you can do with diet that will improve quality of life, symptoms, and may also help fighting the cancer. But if you start restricting your diet so much that you're losing a lot of weight and becoming unhealthy, sorry, I have a message from Kevy to speak closer to the mic. I hope that that's working. Can somebody tell me if it is? Kevy, is this better?
Yes, that's better. Thank you.
Okay. Sorry, everybody. So diets are important, but when you're losing a lot of weight, becoming underweight, then your body basically doesn't have the calories that it needs to assist in the fight of cancer. And so definitely recommend getting guidance from a registered dietitian when discussing diets. Some supplements are helpful, but certainly some supplements can be toxic. I think about things people say if it's natural, it must be safe, but you think about poison ivy or hemlock and you realize that that's not necessarily true. I alluded to this earlier, but a lot of these therapies are quite expensive, and I think financial toxicity is a concern with almost any alternative therapy. And certainly anything, no matter how safe, if it's being used in place of a curative conventional treatment, would be considered harmful. So, for example, if somebody had for a lettuce therapy, they say eat lots of lettuce, that will cure your cancer. So that's unlikely to be harmful, but if somebody is doing that in place of a potentially curative surgery or chemotherapy treatment, then that's a problem. Okay, this is all the downer part of the talk, and now we will get into the happier and more hopeful part of the talk. Oh wait, I forgot, we got to tell you about the ionic foot baths, so this is perhaps a little bit fun. So here again, the idea is that you need to detoxify. That's a kind of a buzzword out in the alternative medicine world. And with the ionic foot bath, the idea is that you put your feet into a tank of water like you see here. There's a little bit of salt in the water, and there's a metal source, and then a current is turned on, and the water turns black. And you see with the color of the water, people are told that that is the method pulling all the toxins out of the bottom of your feet. And people think, wow, that's great. Look I had no idea I had all those toxins in my body. Look at the color of the water. But what's really going on here is just a simple chemical reaction where if you have metal and salt and an electric charge in water, the metal will, the electric charge in the salt will pull some of the metal ions off the metal source and turn the water black. So you don't even need to stick your feet in the tank and you'll get the same result. So here's an example of somebody who set up a similar tank at home, didn't put any feet in there, and you can see the water starting to turn brown. You can do this at home if you're really interested and have a lot of free time. So take a couple of spoons, hook them up to a battery, put some salt in the water, and you can see how the water is starting to turn brown. So at first I thought, well, this is kind of a harmless circus sideshow. If people think they're feeling better, that's not a problem. But then I put it on my harmful list when somebody published a study showing that people who are doing this therapy actually have higher levels of toxic heavy metals in their bloodstream. So what this therapy is actually doing, given the electric charge in the patient's foot in the water, is allowing those metals to be absorbed by the skin. And so I've yet to meet a patient who wants to be toxified, but if you are interested in being toxified, then this may be the therapy for you. But otherwise, I would skip this one. And just a word about detoxification, since it is such a buzzword out there, I'd like to remind people that we are really pretty highly evolved to get rid of toxins. So in addition to the colon, which is the most popular detoxifying organ that you hear about, our skin, our lungs, our kidneys, and our livers are all working hard to get toxins out of our body. So I think if you really want to be natural about it, just support the body in doing what it's already really highly evolved to do. So to support your body in this detoxifying efforts, drinking plenty of fluids so that the blood flows around to all these organs, getting some exercise, again, to help with that process, and trying to stay away from toxins in the first place. So not smoking, not drinking alcohol to excess. Those are where you can make a big difference, and you do not need interventions such as chelation therapy, ionic foot baths, or colon hydrotherapy. So now we move into the helpful therapies, and we'll talk about lifestyle, and we'll talk about CAM approaches as part of the whole integration. So as I mentioned before, these lifestyle approaches are one way that you can take control over your health and give you a more active role in your care. So rather than somebody just telling you, oh, you need to do surgery and chemotherapy, here are some things where you are solidly in charge. I also like them because they either have a low cost associated or they're things that you can do for free. And not only might they help you with current cancer-related concerns, they're certainly helpful to prevent future illness as well. So talking about sleep. So there have been studies that show us that if you sleep well, it improves pain, it certainly improves fatigue, and it improves mood. And almost everybody's had experiences with sleep being important in those areas. They've done studies where they've kept medical students awake for 36 or 48 hours at a time, and in this study, medical students were used, which is why I put normals in quotes, because I don't think medical students are really typical, but at any rate, in this one particular study, these students that were kept awake for long periods of time all developed kind of a chronic, widespread achiness that felt fluish to them, similar to what people with fibromyalgia report. There's also been links with getting, for long-term lack of sleep, breast cancer, and with weight gain as well. So starting with the natural approaches, I call these my grandmother tips, and a lot of these are familiar to people, but sometimes there'll be something in there that somebody hasn't thought about before. So not eating or drinking or exercising right before bed, that's pretty stimulating. Avoiding late-day caffeine is obvious, but alcohol is something that I think people tend to overlook, because alcohol makes people sleepy and helps you go to sleep. But as it's metabolized during the night, it creates compounds that actually will wake you up. So people will often report that alcohol puts them to sleep, and then they wake up in the middle of the night and can't go back to sleep. Exercise is great. Best done earlier in the day if you want it to help with sleep and not interfere. Certainly paying attention to the right temperature and noise and light in your room. If sleep is a problem, establishing consistent sleep times, going to bed every night at the same time, waking up every morning at the same time. And if you're lying there tossing and turning, getting out of bed and going to a different room to read or do something non-stimulating and then going back to bed, so you're basically training your brain that the bed is for sleep and sex only and not for reading and watching television, and not taking naps. Sometimes, of course, you can't help it. If you really were up all night, you may need a power nap in the afternoon, so you're safe to drive, but don't nap for 3 to 4 hours in the afternoon and then expect to have a good sleep at night. And back on sleep, I certainly think I'm an integrative medicine provider. I like to use as little medication as possible, but if somebody is not sleeping well, I think do whatever it takes to get a good night's sleep. And if that involves supplements or medication, then go for it, because you've absolutely got to get your sleep. So exercise has a specific role for cancer survivors, and it's got so much science behind it that there are cancer exercise rehabilitation specialists. So there's a whole specialty around exercise and cancer, and I hope that FIGHT CRC will have somebody come and talk specifically about exercise or blog about exercise and cancer. So I just want to hit some of the high points here. So there's data in lots of different cancer types, and looking just about colon cancer, there have been epidemiologic studies that show people who are the most active versus those who are the least active have a 27% reduction in colon cancer at baseline, and being generally active likely is helpful as well. So here we have Richard Simmons pointing to the data. The American Cancer Society gathered an expert panel and graded what they looked at all the research that had been done for looking at benefits of exercise in colorectal cancer, and they found that if you exercise during treatment, there really is no evidence that's going to help prevent recurrence, and I think that's just too close to the time to tell. But they have seen an overall survival, a possible benefit, and for quality of life, they give it a probable benefit. And you have to know about these expert committees. They hold their data tightly to their chest, and they don't even toss the word around benefit, the word benefit around lightly. So seeing something where an expert committee says there's possible or probable benefit is really a good indication that this is likely helpful. And then after treatment, they have noted that there is possible benefit to help decrease risk of recurrence, probable benefit for overall survival, and still a good impact on quality of life. So exercise during treatment has also specifically been shown to help prevent weight gain, to help decrease fatigue, to improve stamina, to improve balance. And this is, I think, where working with a cancer exercise rehabilitation specialist really comes in handy, because if you've had chemotherapy, that has a lot of effect on your nerves and balance. And working with somebody who understands the effect that chemo has on the musculoskeletal and nervous systems, I think, is important. And then also, like back to the lady I presented who was the marathon runner, I've talked to a lot of patients who can't quite figure out how to fit exercise in because they don't view it as exercise if they can't do what they were doing quite before their diagnosis. And so working with an exercise specialist, if one is available to you, can be a great way to be sure that you're getting enough exercise to help get some of these benefits, but then also that you're not overdoing it, because I hear that as a concern for people as well. Certainly people want to know what's the best thing. I'm always being asked, what supplement can I take to boost my immune system? And the best data is out there for exercise. It can help symptoms. It can improve pain, memory, concentration, definitely helpful for sleep and for mood, and can help your high blood pressure, your diabetes, your cholesterol, can help improve bone mass. Helps with hot flashes, as you see with the hot flash extinguisher there. And so unlike those other things that you hear on late night TV, this product, exercise, can help you lose 20 pounds and improve your sex life. So I'm trying to really sell you on exercise. And if you're unable to get to a cancer exercise rehabilitation specialist, this is a simple acronym that can help you get off the couch and start with an exercise program by looking at FIT, where F stands for frequency, so trying to do something every day just to get into a rhythm. The next most important part of this acronym is T for time, so starting with 5 minutes a day, or depending on how fatigued you are, sometimes less than that is actually an okay starting place. I've had some patients for whom they're really limited to their couch, but they are watching some television, they get up during the commercials and march in place once or twice, and that's their starting place. But if you're able to walking 5 minutes a day and then trying to increase by 1 minute a day each week can be a way to very slowly rework exercise back into your life. And then the I is the least important part of this acronym, but especially after you are through with treatment and you're starting to feel better and better, working on the I for intensity to increase the difficulty of exercise is where you're going to reap the benefits to help prevent recurrence in particular. So we'll move on to mind-body. It's another area where you can help restore control and have a sense of control over what's going on for you in your treatment. I like it because they're generally safe without side effects. And it makes sense because there's a lot that can be done with mind-body to help with symptoms, because perception of symptoms like pain or nausea requires processing by the mind, and you can work to alter that perception. And maybe the picture here shouldn't have been this lady doing a yoga pose, but perhaps should have been a yogi sitting on a mat of nails. So people can do incredible things with the power of their mind. Mind-body therapies can help decrease pain, stress, and anxiety, and as a benefit, they're often covered by insurance. So here are some examples of different mind-body therapies. You've got cognitive behavioral therapy, relaxation techniques. You might be taught breathing techniques, biofeedback. Art, music, and pet therapy fall into mind-body therapies, and mindfulness, meditation are popular. Guided imagery is a mind-body tool that people really enjoy because you can gain perhaps even more control over your disease. Visualization goes along with that. Movement, mind-body movement therapies like yoga, and tai chi, and hypnosis all would fall under the big umbrella of what is a mind-body therapy. Mindfulness-based stress reduction is one therapy that I just wanted to call out. It promotes relaxation through non-judgmental awareness of your sensations, your experiences, and your reactions. You might hear people talk about being present or being in the moment. And there was a study done in cancer patients that showed improvement in mood and stress with mindfulness-based stress reduction. And even after the program ended, people were still experiencing benefits. Yoga is the combination of physical movement, breath control, and meditation. It's widely promoted for patients with cancer, and there is training for yoga therapists to have more experience working with patients with a cancer diagnosis. It's been studied and shown beneficial for breast cancer, so I was curious what the latest research might be for colon cancer and found that a study in Germany was just completed if you look on clinicaltrials.gov, but they haven't published their evidence yet, so we'll see what they found specifically with the colon cancer population. Support groups have been widely promoted, and there have been studies that show that a good support group not only can improve quality of life, but may improve aspects of immune function. And in one study that is very popularly quoted, life expectancy was prolonged in people who participated in support groups. One thing I do want to say before we leave the mind-body realm is that of that list that I showed you of different mind-body therapies, not all psychologists are comfortable with all those methods, and it may be that a therapy such as mindfulness-based stress reduction is taught by somebody who is not a psychologist. But I think, for insurance coverage, trying to find a psychologist who is a health behavior psychologist, those are kind of the buzzwords, the health behavior psychologist. That's a psychologist who works more with patients with medical illness and is less focused on emotional and mental illness. And those are the folks that would be most likely to be able to teach you mind-body therapies to help with your symptom management. And Andy did tell me earlier that Kristen Kilborn, who's one of our psychologists who works with cancer patients, has presented on the topic, and there should be some information then on the website from her. So moving on to nutrition, just a small helping, Louise. I love your cooking, but I have to cut down on saturated fats. I think this is a lifestyle area where people really are interested because it offers a big area of control. And diet is important for cancer. It's been estimated that about 35% to 60% of cancer diagnosis, and this is everything, not just colorectal cancer, but of all cancer diagnoses, diet may account for 35 to 60% of that. And then you can see some of the other risk factors that we're familiar with as well. The biggest way that diet impacts risk of cancer is through overweight and obesity. I want to point out, not necessarily through the specific components that you're eating. And so to illustrate that, here is a study that took a large amount of studies and combined them all together. So it took a lot of epidemiologic studies and that looked at body weight and risk of cancer and put them all together to see what's the risk when you can combine all these studies. And so here you see on this axis the risk of cancer. And so a risk of 1 means that being overweight would not affect your risk one way or the other. If the black box falls on this side of the line, that means being overweight would reduce your risk, and then falling on this side means it increases the risk. So when this study put all the different studies together, they found that the risk of colon cancer was increased about 1.5 times for people who were obese. Rectal cancer was increased about 1.3 or 1.2, you can see here. And the risk was higher for males over females. And then they adjusted for different risk factors and still found that there was an association. So basically, it does look like obesity and body weight is a risk factor for colon cancer specifically. Now talking about more specific nutrition factors, the bad news is I don't have my homework. The good news is my dog got his daily requirement of fiber. So fiber is definitely talked about a lot for colorectal cancer, so let's talk about some of the other specific dietary factors. So fruits and vegetables, we're always promoting eating as much in fruits and vegetables as you can, but as far as whether or not this shows protection for colon cancer, one study did show about a 50% reduction of risk, but then another study did not show an association. And what the experts say is that if increasing fruits and vegetables is valuable, probably you get most of your risk going from about eating 0 fruits and vegetables to getting just over 100 grams of fruits and vegetables. And considering that that's about half an apple, that's not much. So probably the biggest bang for the buck comes from adding fruits and vegetables to a diet that doesn't have any. Then they've looked at red meat, animal fat, and cholesterol, and this definitely seems to be associated with the risk of colon cancer, increasing risk 3 times for the highest intake versus the lowest intake. And then fiber, back to fiber, 4 large studies have shown decreased risk. 2 studies didn't show an association, but it looks like the weight of the evidence falls towards fiber being beneficial. And talking with Andy in the group earlier, I understand that there is a webinar coming up in the not-too-distant future that is going to specifically talk about nutrition, and so I would encourage all of you to attend that webinar. A plant-based diet, less meat and dairy, likely is helpful. Getting more fruits and vegetables, high fiber, low saturated trans fat, less omega-6 fatty acids, the bad fatty acids, and more omega-3s, and limiting alcohol. And the number one thing to reduce risk is trying to attain a normal body weight. So here we see from the AICR, which is the American Institute for Cancer Research, they're primarily interested in all the research around diet and cancer risk and treatment. They put this little graphic together showing how diet, physical activity play into weight management, but also independently contribute to reducing a cancer risk. And the website for the AICR is aicr.org, and it's actually a wonderful resource with lots of research about cancer and diet. And they also will send you, if you sign up, a weekly recipe that's cancer healthy and heart healthy, because both basically what's cancer healthy is heart healthy as well. And the recipes are really good, I can tell you from personal experience. I will skip this over, but just to point out that we've moved away in general from the food pyramid and moved towards more looking at the healthy plate that has healthy oils, mostly fruits and vegetables, whole grains, and just a little bit of protein and water for the beverage rather than lots of milk or coffee with lattes at any rate. But this is available from the Harvard School of Public Health, and I think really simplifies the whole idea of what does it mean to eat healthy. Of course, those are not the nutrition questions we get in integrative medicine. We get the question, should I take supplements? Does sugar feed the tumor? Do I have to eat organic? And I am going to move in talking about supplements, and just one word on organic, and I encourage you to ask the dietitians that will be presenting the nutrition webinar. But in my conversations with them, they say organic is great if you can afford it, but they don't want people not getting fruits and vegetables if they're not organic. They don't think there's harm to non-organic foods, so people worry about pesticides and things like that. They think the value in organic is that organic foods may have a little bit more nutrition to them. And the theory there is that if you're not spraying your foods with pesticides, then the plant has to create its own pesticides. It's got to create its own way to defend itself from attack from bugs and so forth. And what that looks like to you and me is just extra nutrition in the fruit or vegetable that has to do its own work, whereas the fruits and vegetables that get sprayed with pesticides don't have to work so hard to prevent infestation, and so they're maybe not as nutritious. So that, of course, is the 50,000-foot view, and I would definitely encourage you to discuss that topic a little bit more with the dietitians. And as for does sugar feed the tumor, yes, it probably does, but the other thing to keep in mind is that sugar is also feeding your brain, and so less sugar is a good idea in general for a healthy diet, but people who, again, are restricting themselves to the point where they're losing weight are not doing their immune systems any favors. Your immune system needs some fuel as well, so does your brain. So here I think the message is, if you really, really like donuts and you want to have one donut a week, you're not going to be hurting yourself. But do not subsist entirely on junk food, but we knew that already. So talking about herbs and supplements, I like to think of herbs and supplements as being medications. There are three types of medications. Prescriptions that you have to see a healthcare provider to get access to. Medications which are deemed safe enough to be sold without a prescription that have also been through FDA review process, over-the-counter medications. And then this category of dietary supplements. Unlike prescription and over-the-counter medications, things that are labeled as supplements are not required to prove safety or efficacy before being sold. They're not required to enforce quality control, and they can vary tremendously in concentration of ingredients. And so it's definitely buyer beware here. And actually, I'll put a caveat on those bullet points. In legislation from a few, I think it was 2004, the Dietary Supplement Health Education Act overhaul, they did say that manufacturers of supplements do need to be manufacturing under good manufacturing practice. However, the burden of proof that they're not doing this is on the FDA. And similarly, they don't have to prove that their supplements are safe. The burden of proof is on the FDA to say that they're not safe. This is just too big of a group for the FDA to really monitor when they have other things on their plate. And so definitely want to be mindful when you're considering.
Hi, Dr. Corbin. I think we're having a little bit of sound issues. I think
Okay.
it's the internet speed. I'm sorry. If you could just repeat the.
Oh, I just lost you too. I think you said repeat something. Andy?
If you could just repeat the last couple of things that you just said, we're losing the sound a little bit.
Okay, sorry about that. So, and even though I'm from North Carolina, I know I speak way too fast. So, considering the internet, I will slow down a little bit. So, herbs and supplements, I like to think of them as medications. They kind of fall between the cracks, and they are not prescriptions, so you don't need to see a doctor to get them. They're not over-the-counter, which are medications that used to be prescription that have been shown to be safe and effective, but are deemed safe enough that a consumer without a medical background can choose to use them and be safe. And so products that are supplements are not required to prove that they're safe or effective before being sold. The burden of proof to show that they are not safe falls with the FDA. Manufacturers who make supplements are actually required to manufacture under good manufacturing practice. However, the burden of proof to show that they are not using good manufacturing practice falls onto the FDA. So in effect, they're really not required to have quality control. And that's really just good manufacturing practice more than standardization and so forth. So you can get a lot of variability in concentration of ingredients of supplements. A lot of patients who have a cancer diagnosis do use supplements for sure, so we'll talk a little bit more about them. So in general, just because it's natural doesn't mean it's safe. As I mentioned before, poison ivy is natural but not safe. Hemlock is natural, but that's the way that Socrates killed himself. So not in tobacco, that's something that's very natural and not safe. So throw that one out. If you're taking prescription medications, you want to be extra cautious. Also taking supplements, we do know some things about herb and drug interactions, but a lot of things we don't know. And be careful where you're getting your information. So they've done surveys where people walk into a health food store and ask what to take for cancer and get just a tremendously variable kind of recommendations. And internet, most of the internet is about commerce. They're trying to sell you something, so take that with a grain of salt. Natural Medicine's comprehensive database is a good resource, and the Office of Dietary Supplements also a good resource. And on the last slide that I'm going to show you is a resource list that has these websites that you can use to go and peruse. If you are taking a supplement, can you guys hear me? This just popped up again. I'll try to adjust my microphone. I have to eat it to get it any closer to my mouth, so hopefully this is okay. I'll hide this again. If you do choose to take a supplement, you want to look for a well-labeled brand. Here's one of my favorite things to look for on the label. This is the Dietary Supplement Verification Program through the United States Pharmacopoeia. And the USP sets standards of strength and purity for prescription and over-the-counter products and has this Dietary Supplement Verification Program. And so where standards have been agreed upon, they will go and take products off the shelf and test them and allow the manufacturer to put this label on the label if the product meets their standardization specifications. So if you see USP on the label, that means that the product has the ingredients it says it does, that it's in a form the body can use, that it's been made according to good manufacturing practice, and that it has no contaminants in it. So you really, that's a great mark of a good product. It's not a brand in and of itself, it's just an independent mark that this is a good product. And watch for the combination products. I think in general it's best to start with one supplement at a time, so you'll know if you have a bad reaction, when it might have been to, or if you have a good reaction, when to quit it. I also watch out for multi-level marketing sales. So some of the products that are sold by these groups are good, but the way that they're sold in sort of the pyramid scheme winds up making them quite expensive, and you can get good products without going through multi-level marketing. Some red flags that make the hair on the back of my neck stand up are the infomercial, the ads disguised as news articles, the back of the magazine ads, the testimonials. And be cautious if somebody claims to cure something, there's nothing out there that's 100% effective. And then certainly if they say, oh, secret ingredients or one manufacturer only, make it seem like it's very hard to get, that should be a red flag as well. So I'm not paid money by any of these people, so there's no kickback here, but these are some manufacturers more likely to produce quality products. And I like to tell people, go for the cheapest thing you can find that's high quality. And you'll see this is Kirkland, which is Costco's house brand. They have USP symbol on the label. So again, pointing out that this symbol is pretty small and it's just on the label and it's not the brand itself. But this is what that symbol looks like when you see it on a bottle. So Nature's Way, Nature's Made, Nature's Bounty tend to make good products. The Costco house brand, Walmart and Target have Equiline and Equate, and those are high quality. Phytopharmaca and Pyrenees Pride. In general, patients are told to avoid supplements during treatment, and that's a very broad recommendation, but some of the concerns are that things that are high in antioxidant potential might decrease the effect of some chemotherapy and radiation, which have their effect against the cancer cells by causing oxidative stress, and that's what's killing the cells. And there's concern that you might be protecting those cancer cells by taking high doses of antioxidants. There are some supplements that directly inhibit some types of chemotherapy. So St. John's wort is often recommended for depression, and it does look to be effective for mild to moderate depression. However, it's the poster child for drug interactions, and it revs up the metabolism of a lot of different medications, and some of those are chemotherapy medications. And so taking St. John's wort with chemotherapy may lower the effective dose of chemotherapy that you're getting. And then there are some supplements like fish oil, vitamin E, ginger, garlic that increase your risk of bleeding. And so if you're having surgery, that might be a problem. And then others that may interfere with anesthesia. So just as a general guideline, avoiding supplements during treatment is probably the better point of valor. But after treatment, there may be more of a role. After treatment supplements that I think are worth considering, and actually I'll put a caveat here and say if you're working with a dietitian through a cancer center, then something like glutamine or probiotics taken during treatment may actually be helpful to prevent some of the side effects that treatment can cause without causing a reduction in the efficacy of your treatment. Ginger to help with nausea during chemotherapy also. Melatonin can also help with sleep. And then there was a Cochrane collaboration review in 2012 looking at Chinese herbal medicine, which is definitely different than Western herbal medicine. And there are a few studies out there showing that taking Chinese herbals along with chemotherapy may improve response rate. But I would say this is definitely not something you want to be doing on your own. You want to be working with an integrative medicine center that's associated with an academic hospital. And I believe I have a website for you on the resource list. If not, I can tell you where to find an academic integrative medicine center. Just gotten a message from somebody that they want me to call in. So I'm going to pause. I'm really sorry about this. I'm going to try to call in and see if that helps the sound quality. And we were chatting.
Yeah, sorry everyone, the internet speed is pretty slow, so the sound is not working properly. So we'll have Dr. Corbin call in and we'll pick back up.
Okay. Can you hear me on the phone? Hello?
Yes, we can hear you.
Okay, is that better?
Much better. Thank you very much. Sorry everyone, we'll begin again.
Do you want me to go back at all? Or just
Let me
continue?
ask. Let's just start with the previous slide. That would be great.
Okay, so we'll start with this previous slide and then certainly welcome to questions at the end. So in general, the recommendation is to avoid supplements during treatment without specific indications, and one concern is that antioxidants in particular might decrease the effect of chemotherapy and radiation. Part of the way that radiation and some types of chemotherapy work is by creating a lot of oxidative stress, and that oxidative stress is what kills the cancer cells. And so the concern is if you're also taking an antioxidant, you may be protecting the cancer cells from the damage that chemotherapy and radiation are supposed to be doing. So there's also concern with certain supplements may be having drug interactions, and the poster child for this is St. John's wort. So St. John's wort is effective for mild to moderate depression, so it's a pretty popular herb in that way, but it's one of my least favorite herbs because it has so many drug interactions. And so what St. John's wort does is speed up the metabolism of a number of medications. And some of the medications that are affected by this specific speeding up the metabolism by St. John's wort fall into the classes of chemotherapy. And so in certain cases, St. John's wort may actually make the chemotherapy get metabolized faster and therefore not as effective. And then there are some supplements like fish oil, vitamin E, garlic, ginger, ginkgo that may increase risk of bleeding. And so you'd want to avoid those around the time of surgery. And then there are other supplements that might interfere with anesthesia. So it's kind of a blanket statement to, in general, avoid supplements during treatment. There are some caveats to that point. So glutamine, and I think here, especially if you're working with a registered dietitian affiliated with a university cancer center, or if you're working with an academic integrative medicine program while you're going through treatment, that's a way to be a little safer when thinking about taking specific supplements in general. And during treatment, there may be a role for glutamine to help protect from mucositis and issues with the colon with chemotherapy. Probiotics may be helpful. Ginger was shown in one study to be helpful for nausea around chemotherapy. Melatonin can be helpful and helpful for sleep as well. And then in one review, traditional Chinese medicine was shown to be helpful, but I would definitely do that only in conjunction with an expert and not do that on your own. So acupuncture I'd like to touch on because this is one of my favorite therapies. And to understand acupuncture, there's two ways to look at it, Chinese medicine and and Western medicine. And in Chinese medicine, they view health as a balance of two oppositional forces called yin and yang. And when yin and yang interact, they create an energy force called qi. And qi is carried throughout the body on meridians corresponding with specific organs, although when Chinese medicine providers say pericardium, they don't mean the lining of the heart. They're talking about the organ in a different way. When you have too much qi, or your qi is not flowing well, or you don't have enough qi, that's when in Chinese medicine you're said to get sick. So examples of traditional Chinese medicine diagnoses would be yin deficiency and yang predominance with reduced kidney qi, or one of my favorites is stomach qi rebelling. So when you hear that the microphone's not working and you're cutting in and out and annoying a lot of people, then you get a little stomach qi rebelling yourself. But that's getting better. So in Western medicine, you can go back to one of the fathers of modern medicine, Sir William Osler, and find that he said he liked acupuncture for low back pain, but it turns out that he was talking about sticking a lady's hat pin into the area of the back where it hurts. So it's quite different from acupuncture as we know it today. There was a reporter who traveled with Nixon to China in 1971 and had his appendix out while he was there, and he had regular anesthesia during the operation, but post-operatively had a lot of pain, and he was really surprised when they sent in the acupuncturist instead of the medical doctor. He had a lot of benefit from acupuncture for his pain, came back and wrote a lot about it, and that's when Western medicine started to get interested to see how could this possibly work. And they found that acupuncture activates local nerves, releases feel-good chemicals like endorphins and your body's own opioids, ACTH, which is a chemical that helps reduce inflammation. And then you can do functional brain scanning and show increased activity in the brain when you do acupuncture. For patients with chronic pain, the areas of the brain that help prevent pain light up, and the areas of the brain that perceive pain get tampered down a little bit. So what can acupuncture do for patients with cancer? So dog versus porcupine, that's one way to do the acupuncture. But I would say in general, it's very safe. We don't use porcupines in our practice. Minor adverse events. And even if you have low white blood cell count or low platelets during treatment, and if you're working with somebody who's used to working with patients with cancer, this should be totally safe. Just make sure that the provider is using an alcohol wipes to avoid infection, and all is good. So that you can look up to find good providers, traditional Chinese medicine or physician providers of acupuncture. And sometimes insurances cover acupuncture, which is nice. If not, it generally runs around $100 for an initial treatment, $55 for follow-ups. And for nausea and vomiting due to chemotherapy, we recommend that patients have acupuncture within 24 hours of the chemotherapy. So coming in the day before, the morning of, the day after is generally when it seems to be the most effective. But this is an area that's been very, very well studied, and pretty much there's universal agreement that a big benefit of acupuncture, as I illustrated in one of those cases, is that you can really reduce nausea and vomiting due to chemotherapy. There have been some studies that show it may help your bowel return to function a little faster post-op. Can be helpful for neuropathic pain that you might have after chemotherapy. For pain in general, studies show that it can help mild to moderate depression. It might stimulate the immune system, but we really don't know if that makes any clinical difference. And it's been recommended for dry mouth, and there's some studies that support the use for dry mouth as well. Massage therapy is something that most people are familiar with, and there's different forms, which tends to be intimidating, but really they all have in common improving circulation, reducing tension, and being calming and relaxing. So is massage safe? If you're Gumby, massage may not be the best therapy, but otherwise very safe. Some patients have been told that massage will spread the cancer, but that's been studied and looked at and not felt to be true, because massage does not increase the circulation much more than a vigorous exercise or a really warm shower. So massage is not going to spread the tumor. And there are definitely benefits for patients with cancer for massage. Generally, it's safe. If you have bad heart failure, massage is great at putting the fluid back into the circulation, and so massage therapist could get rid of edema in the legs, but if your heart's not working well, that could be dangerous. You don't want to have a massage over an area of infection or a blood clot. If you have really low platelets or you're on an anticoagulant, you want to work with a medical massage therapist and somebody who's going to use a lighter touch. Similarly, if you have thin bones because you have metastatic disease in your bones or you have osteoporosis, you want to work with somebody who's knowledgeable about working with cancer patients. And there is extra training for oncology massage available that some massage therapists will take. And if they're involved in the American Massage Therapy Association, that's likely somebody who is treating their massage more as a long-term career. But if you can find somebody affiliated with a hospital, that's your best bet. So it's been shown to help with relaxation, improved quality of life, depression, anxiety, sleep, postoperative wound healing, lymphedema, pain. All these things have been shown to be helped with massage therapy. So how do you find a good provider? Here's Denver Yellow Pages for acupuncture, so you could just start cold calling. But I think going on recommendations from your physician or from friends or people you know in a support group, and then doing just interviewing a couple of people and asking about their training and licensure, what's their experience with cancer, what are the expected benefits. So here, of course, you want somebody who does have experience working with cancer, and when they tell you about the benefits, just have the red flag sign go up if they tell you they cure everybody or they're 100% beneficial. Similarly, if they say it's 100% safe, that's probably somebody that you would not want to work with because they should be able to quote you some risks or side effects. What are the costs? Will insurance pay? How are we going to assess progress? So any hands-on therapy that you're doing for a symptom, say neuropathy or pain management, I usually tell people 5 weekly visits of acupuncture or massage, and you should see an effect. And if you haven't seen anything at 5 visits, that's a good time trial. And then certainly you want somebody who's willing to communicate and integrate and work with your conventional providers, and not somebody who's going to tell you that they are directly treating your cancer and that you need to stop active treatment. So in summary, you can safely integrate CAM treatments with conventional treatments. The #1 rule is avoiding the harmful therapies, but use therapies shown to be beneficial. Don't overlook the lifestyle approaches. If it sounds too good to be true, somebody claims 100% benefit, move on. And consider things that are safe and at least plausible, because if they help you, they are beneficial. Find good practitioners, use good resources. I have a resource slide coming up in just a sec. But encouraging everybody to be open-minded, but not so open-minded that your brains fall out. And here is the resource list I was alluding to, and I want to point out this is our website if you want to learn more about us. The National Cancer Institute has good information on complementary alternative medicine, and here are a couple of websites for you. American Cancer Society, you can search for information on integrative medicine and complementary medicine, and that's a good resource, as is the American Society of Clinical Oncologists patient information. Nutrition, I mentioned that one already. Supplements, this is the Office of Dietary Supplements. This is the website I was talking about for the Consortium of Academic Health Centers for Integrative Medicine. So we have 61 members across the country. These are academic health centers like University of Colorado Hospital that have integrative medicine programs associated with them. And then the National Center for Complementary and Alternative Medicine is part of the NIH, and they're a good resource as well. So at this point, I'll turn it back over to the home team and look forward to a question and answer session.
Thank you so much, Dr. Corbin. We're going to get set up with the question and answer session. So if you have any other questions from the audience, please use the chat or the question feature, and I'll try to get those to Dr. Corbin. I'm going to turn over the PowerPoint slides now so that you'll be able to see our questions and our resources that we have. So I think starting off with an overarching question, Dr. Corbin, if someone is interested in integrative alternative medicine, but their healthcare provider may not be experienced with this or may not know much about CAM, what do you recommend? How do they start exploring CAM, but they may be afraid that their provider will know about it, or how should they proceed?
That is a great question, and I hear that one from patients a lot of times. So I think, and I forget about that somewhat because we're here at the University Cancer Center where they're very happy that they are working with an integrative team and that they have that to offer their patients, and so it's such an easy relationship. And I think that's the case at a lot of these academic integrative medicine centers, that they've got close working relationships with their cancer care team. But I think, there are still some docs out there who are not comfortable with the idea of integrative medicine or complementary alternative medicine. But I think having that open conversation is important. There's a few resources. One is through the NIH and through the NCAM. So the NCAM website, that's the National Center for Complementary Alternative Medicine, they have a whole section on talking to your doctor about alternative and integrative medicine. Their campaign is called Time to Talk. So if you go to NCAM's website and search for Time to Talk, there's a lot of tips there for talking to your doctors about integrative medicine. I think you'll find most doctors are open to the idea, and if you can present them with the information from the NIH, that's helpful. And reassure them that you are wanting to do things under their guidance that aren't going to be harmful or interfere with treatment. And I think most oncologists probably even better versed than a lot of other physicians on which things to definitely stay away from and which things might be helpful. But I'd say if you do get a doc who absolutely closes down and says, over my dead body, are you going to do acupuncture or something dramatic like that, you may want to rethink the oncologist that you're working with. Because I think 99 out of 100, hopefully oncologists are going to be much more open to the idea, willing to work with you, may even have somebody that they can refer you to that they trust.
Thank you so much. So these next couple of questions are in regards to diet and supplements. So one question is, how do you feel about the idea that sugar, white flour, and anything that promotes, quote, inflammation contributes to the recurrence of colon cancer?
Yeah, so I think for the specific idea of recurrence, the specific dietary factors like sugar and white flour, we don't really have data yet. Nobody has yet done a study that I'm aware of that looks at epidemiologically people who have those specific dietary components in excess amounts compared to people who have very little of those components. Nobody's looked to see over 10 or 20 years what the risk of recurrence is. So I think, and then certainly nobody's done a study where they randomize cancer survivors to a diet that's high in white flour and sugar versus a diet that's low in those components, and I don't think anybody will ever do that study. So it's definitely still in the theoretical area, but I think theoretically, yes, white flour, white sugar does increase inflammation. It's just not good for your health in general. So I don't think you have to run away from it and absolutely never, ever, ever use any sugar. But I think being mindful of trying to have a healthier diet that's high in fruits and vegetables, low in saturated fats, and as low as you can go in the added sugar and the white flour realm is a good idea. Whole grains are better. But if you are, again, it's a balance there. If you love having a donut every Friday morning with your coworkers, then have a donut on a Friday morning and don't stress too hard, because that would be a drop of water in the bucket. But I think the idea of cutting back on white flour and sugar, we can all stand to do a little better there, and that's just helpful for moving us all towards a good, healthy diet for not only for colon cancer, but for all the other health problems that plague us Americans.
Thank you. So calcium has been suggested as a supplement to assist in preventing the recurrence of colon cancer. But this person says, however, some articles have suggested that calcium supplements may increase coronary artery disease risk. Have you heard about calcium being related to colorectal cancer recurrence, and then that risk benefit, if so?
Yes, I have, and thanks for mentioning that. I realize now I dropped out slides on calcium, but I do think there is some data to support the use of calcium. The data for the heart disease is kind of interesting, because there are definitely studies that show that people who consume the most dietary calcium, so getting it through the diet like milk and cheese and yogurt and green leafy vegetables and so forth, people who consume the most dietary calcium have the lowest risk of heart attack, and people who take the most calcium supplements have a higher risk of heart attack. And so people are trying to figure out why that's true. And so what they've shown is when you get your calcium through your diet, the levels of calcium in the bloodstream just go up a little bit gradually. But when you take a calcium supplement, you get a big spike in the level of calcium, and then it goes down again. And the concern is that when the calcium level spikes, calcium is deposited in the coronary arteries and contributes to the burden of plaque in the coronary arteries. And so perhaps that's why there's a bigger risk of, or there's at least an epidemiologic link shown between calcium supplements and heart attacks. So that was a big study that hit the news last year, and then right after that was a study that didn't hit the news so much that showed no risk between calcium supplements and heart attacks. But my take on the calcium situation is, if possible, try to get calcium as much as you can through diet and supplement what you can't get through diet by taking dietary supplements, because at least, keeping your bones healthy for sure. But don't take more than 600 milligrams at any one time. So if you can find a supplement that's 300 milligrams, that's probably more like what you would get when you're eating dietary calcium. And so you could be just a little mindful about the kind of calcium supplementation that you're doing, and then trying to get as much as you can through diet is probably prudent.
Thank you. So we've had some other questions come up about multivitamins during chemo, especially for stage 3, and also eating fish. Is that safer than white meat?
So these are great nutrition questions too. So again, I want to remind folks that you got a nutrition talk coming up. So I will try my best, but I would definitely encourage people to attend the nutrition webinar and ask some of these questions too. So the idea of fish versus white meat, I love the idea of omega-3 fatty acids. They're anti-inflammatory, and fish have them for sure. And so if more fish is probably more helpful than red meat, for example. But I think there have not been any risks that I'm aware of showing that other white meats like pork and chicken to have any harm for people with colon cancer. Fish is probably just the healthiest meat choice, and then the white meats, and then at the bottom of that would be the red meats. And what was the other question?
Just about multivitamins.
Oh, the multivitamin question, yeah. So I think taking
during
a multivitamin,
chemotherapy,
yeah. So in general, if you're getting fruits and vegetables in your diet, a multivitamin is probably overkill and just contributing to expensive urine. But if you are recommended to take a multivitamin by your doc, then it's, what I've heard from talking to our dietitians and pharmacists is that the antioxidants in a multivitamin, just a plain old regular multivitamin, are likely not going to interfere with the chemotherapy. But I would have people ask that question in particular of their oncologist, because I've also seen some difference of opinion regarding multivitamins, where some oncologists will tell people to stop them and others actually encourage people to take them. And so, and in that kind of situation where you have experts giving conflicting information, I think our natural instinct is to throw our hands up in the air and run away screaming. But I think sometimes I take comfort when experts disagree, because to me that says that we really don't know what the absolute right answer is. And so it's probably not extreme in one way or the other as far as being harmful or helpful when you have people who've got, experts who've got that widely differing opinion when there's no good solid research to guide them. So I would defer to an individual's treating oncologist on the multivitamin.
Thank you so much. I think that's all the questions that we have time for in this discussion. However, we are going to be able to post some more questions in the follow-up blog to this, and hopefully answer a few more questions that we didn't get to in this discussion. So I just want to thank Dr. Corbin for her time and the wonderful presentation. I want to remind everyone that we will have the presentation uploaded on our website. Hopefully we'll be able to smooth out some audio issues that we've had. So thank you for your patience with that. Thank you again. We really appreciate it. And any further questions, feel free to get in touch with us, and we will include those in the frequently asked questions when we do a follow-up blog on this presentation. So thank you very much.